So our next speaker is Natasha Kumar. Natasha is a policy analyst at Families USA, where she provides critical analysis and strategy on key issues such as surprise billing, prescription drug costs, private insurance coverage, health equity, health systems transformation, and maternal and child health. Natasha has a master's in public health with a concentration in health policy from George Washington University and a Bachelor of Science from The Ohio State University. Before coming to Families USA, Natasha served as the Health Policy Fellow for Congresswoman Doris Matsui, where she worked on a wide range of issues, including telehealth, prescription drug costs, mental health, surprise billing, and special disease groups. Thank you for being here today, Natasha, and sharing your insights on this topic with us.
Great, thanks, Margaret. Let me just share my screen. Okay. Can everyone see this? Okay, great. So thank you for inviting me to speak this morning, and thank you thank you to everyone for attending this Saturday morning session. It's a really important issue, and I'm really glad that we're talking about it. And just a little bit about Families USA. We're a nonprofit, nonpartisan consumer advocacy organization, and our core, our four core pillars of focus are health equity, health value, healthcare coverage, and consumer experience. And so, as you probably all have gathered from Steve's story and Mandy's intro to surprise billing, this issue falls squarely within, I would say, health equity, health value, and health coverage, and consumer experience. So squarely within our pillars of work. And so I'm going to talk a little bit today about what's going on at the state level and also the federal level to give you guys an overview of legislation, what that looks like, and kind of where we're headed, and hopefully answer a few of the questions that Margaret and Mandy had in regards to do we need both pieces of legislation for comprehensive consumer protection? So Mandy did a great job of covering this with Jesse. So I'm not going to spend too much time here on this slide, but I did want to point out a few statistics. I know Mandy gave a great overview of what's happening in Tennessee, but on a national scale, almost 1 in 5 ED visits result in out-of-network charges. So that's almost 20%. That's a pretty big statistic. And more than 1 in 5 claims for lab services provided at in-network hospitals are billed as out-of-network. So that's more than 20%. And again, that's another situation of, you know, lab offices being located perhaps in in-network hospitals, but not actually being a network, and you know, no consumer transparency regarding that. So here's a map of the states. As you can see here, the states highlighted in blue are the ones that have passed legislation protecting consumers from surprise billing. And so in total, we have 32 states here. But I think something really important to point out is that, as you can see, this is not a partisan issue. There are red and blue states across the country that have passed consumer legislation. So any stalling that might be occurring, any roadblocks, it's really not, from what we can see, it's really not a partisan issue. And I'll talk a little bit about the roadblocks that we're facing at the federal level, especially because state dynamics differ, obviously, from state to state. But you know, it's an issue that affects consumers across the board, regardless of you know, party affiliations, regardless of what state you're in, regardless of geographic location. So really important to get something passed here. So, you know, the 50 states are pretty different, and their surprise billing legislation also differs, you know, state to state. And so I think I just wanted to go over at a very high level what the differences that we can see in state legislation. And I've kind of separated them into 2 different buckets. So the first bucket is payment mechanisms. So how exactly in a surprise billing situation do providers get paid? And how do we figure out how much insurers need to pay? You know, assuming that we're holding these consumers, these patients, harmless of the cost. And the second bucket is protections. To what extent do these pieces of legislation protect consumers? And so one thing that I want to mention across the board, across all pieces of legislation at the state and federal level, providers are held harmless from out-of-network billing. So in the case that they have a surprise medical bill, they are responsible only for the in-network cost of the service that they received. So having said that, now how do facilities and providers and insurers reconcile that difference? So there's three different types of what we call payment mechanisms. One is a benchmark and an independent dispute resolution, otherwise known as IDR arbitration model. The second one is what I call greater of payments, and also the option to go to an IDR. And the last one is just straight arbitration, so also IDR. So a little bit about these. So benchmark plus independent dispute resolution. So a benchmark model essentially means that there's a certain threshold at which the bill has to be, so a monetary value. So we'll say $700. So if the bill exceeds $700, then the provider has the opportunity to say, look, I think that I actually want more money for this service. And they have the option to then trigger what we call arbitration, where they would engage a third-party arbiter who would then look at the case independently and say, you know, based on these criteria, I think that yes, the provider deserves to be paid more, or no, I think the insurer amount is actually the correct amount. So that's in that scenario when you have a benchmark. So anything below the $700 threshold would just be the payment. So say the service was $200, then the insurer would just pay the provider $200, and that would be the end of it. And remember, the consumer is held harm. So the consumer is out of this situation completely. The consumer has paid their in-network dues, and that's it. The second one is a greater of payments, which is just the insurer would pay the greater of some set of amount. So either it's a Medicare rate or like 50% of Medicare, or like some set amount depending on the state you're in. And then the provider could then say, you know what, I think I'm owed a little more, and then they could trigger the arbitration. And the last one is just arbitration. So there's no like benchmark payment, there's no initial payment. The whole bill is just disputed in arbitration. And then to our second bucket, protections. Depending on the state you're in, depending on what the legislation looks like, there are some protections that could be there and could not be there. So some states are protecting consumers from ground ambulance surprise medical billing. So how Mandy mentioned, you know, when Jesse was going to the emergency department, he had to take an ambulance, or they had to take an ambulance to get there. And the ambulance was likely out of network. And so some states are able, it's a very tricky dynamic, but some states are able to negotiate ground ambulance protections in their legislation. And to an earlier point regarding self-funded plans, some states are getting around that issue by allowing self-funded plans to opt into these protections, because as was mentioned before, self-funded plans are regulated by the federal government under ERISA. So that is a bit of a loophole there, or I guess a barrier to full protections. But some states are attempting to get around that by allowing this opt-in option. And some states only protect emergency surprise billing situations, and some states protect consumers from both emergency and non-emergency surprise billing situations. So this is I know that was a lot of information, but believe it or not, that's a high-level overview. And of course, you know, there's so many states, and so each state has their own, you know, minor variations as we go through it. So at the federal level, there's been a lot of proposals. So this kind of debate started around last summer, so summer of 2019, where we first saw all these hearings and pieces of legislation come out. And so this is the way I like to think of it, because there's so many pieces of legislation, I like to group them in my head based on their payment mechanism. That's just easiest for me because there are differences across the pieces of federal legislation. So that's what I've done here. So as I mentioned the payment mechanisms before, so there's a group of them that have a benchmark and arbitration payment mechanism. There's one that has just an arbitration mechanism, and there are compromise bills where committees of jurisdiction came together and compromised on these previous pieces of legislation. So I wanted to kind of break down just a couple of big pieces of legislation at the federal level, just to give you an idea of what that looks like. So in December of 2019, at the end of last year, the Senate Health Committee and the House Energy and Commerce Committee came to a compromise that had a benchmark and an IDR payment system. So remember, the benchmark is that threshold amount. So in this piece of legislation, they set $750 as the threshold amount to trigger an arbitration. And of course, the provider has the opportunity to take it to arbitration after. Since then, there has been, so this is actually very new intel on the Hill. So these are what we call potential pieces, because there's really no confirmation, no bill text that's been released, nothing like that. But so potential pieces in new negotiations that we could see would have a benchmark. There's been no like threshold that's been noted or anything like that. And a independent dispute resolution that would have a few provisions that would make it a little more palatable for provider groups to really join in and be supportive of these things. One thing that's important to know about these payment mechanisms is that in an arbitration-only model, we've seen some states do have an arbitration-only model, and those that have had their model implemented for a while, we've seen that providers tend to win arbitration more often than insurers, which means that the amount that's being paid tends to be more than what insurers would have wanted to pay, right? So the cost would be a little higher. So in the long term, some policy analysis has shown that there may be an increase in premiums in the long term because the insurers are paying out more than what they would have originally intended. So the question is, how do we come to a compromise, you know, both at state and federal levels, to make sure that we're protecting consumers in the here and now, but also ensuring that long term we don't see an overall increase in costs, right? Because then again, we would see the consumer taking on the brunt of that. So at the federal level, here are some barriers to action, and you know, these are also transferable to the state level because these are all going on at the state level also. So at the bottom here, you see heavy industry and private equity interests. So one of the biggest things that really stalled federal legislation from moving last year is a huge like lobbying campaign from private equity that really halted things, and you know, their influence over certain members of jurisdiction and key members in office that really could push this legislation forward. The second thing was various competing bills. You saw the large list that I presented earlier. They're all different. They all have different components. And so you can see where things could get a little fuzzy and, you know, just a lot of information. And last but not least, of course, is there's been a massive shift in priorities at the federal and state level due to the pandemic. And so right when we saw surprise billing legislation really picking up momentum in terms of compromise, COVID-19 hit. And so obviously there's been a massive shift towards COVID-19 relief priorities. So to an earlier question that was asked, do we need state and federal legislation? And I would posit yes. I think that there are things that states can accomplish that you can't accomplish at the federal level, and vice versa. There are things that the federal government can do to protect consumers past what states are able to do. So by passing state legislation, you could protect consumers from ground ambulance surprise billing, which is something that you really have to dig in at the local and state levels. It's very difficult at the federal level to parse out those tiny contracts that ground ambulances have at the state level. And there's also an opportunity to really make a nuanced payment mechanism at the state level, something that really speaks to your residents, something that really makes sense for, you know, Tennesseans. And at the federal level, there are air ambulance protections. So air ambulances can only be regulated at the federal level. So that's like helicopter in an emergency situation, God forbid. You have an emergency health situation and you have to be, you know, transported via air. Those can cost tens of thousands of dollars and are more often than not out of network. There are very, very few air ambulances that contract with insurance companies to be a network. And so that's something the federal government has jurisdiction to protect consumers for. And of course, self-funded plans, the federal government, under ERISA can mandate that self-funded plans protect their consumers from surprise billing. And of course, if passed at the federal level, there would be consumer protection in those states that are unable to get surprise billing legislation passed. So really, I do think that working in conjunction is the best way to protect consumers from surprise medical billing. And as you can see, there are certain gaps that only certain governments can fill. So that's it for me. If you ever need any other technical information, any other resources, we have published a lot of resources. Please don't hesitate to contact me. And also, we do collect patient stories, consumer stories of patients that have experienced surprise medical billing to use for our No Surprises campaign on the Hill. So, if you or a loved one has ever experienced that and would like to really amplify your voice and your experience, the link is there. And I think I'll be able to share my slides after this, or even just share some links with you guys. So thank you.
Thank you so much, Natasha. That was a really informative presentation laying out both the state and federal landscape. That was really helpful for us. We have just a couple of really good points in the chat box here. I just wanted to bring up, Walter Davis says a 2-mile ambulance trip and the things associated with that costs $1,000 for him or someone he knows. Just to highlight again the importance of legislation and surprise from ambulance costs. And then one clarifying question for you, Natasha. You mentioned some of the barriers to legislation here, and you mentioned one of them as being the COVID pandemic. But one question is, shouldn't surprise billing be a part of that COVID relief? Isn't this an issue that we faced during the pandemic as well?
That is a fantastic question. And from an advocacy standpoint, that has really been one of our biggest pushes, is making sure that surprise billing protections are included in any future COVID packages. Unfortunately, that has not, obviously it has not happened. And I don't know, there's just a lot. I mean, now we're seeing just a halt in COVID package negotiations altogether. So there's that issue. And then there's also competing priorities. It's always a question of making this priority at the top of the list of priorities, because when you talk about Hill priorities, it's like a 100-page list. And so it's difficult. It's difficult to get your voice heard. And I would just encourage advocates and all of you to really, keep pushing. And, we're at Families, we've continued to keep pushing. And it is a time where people are most vulnerable, and, people are losing their jobs and they're finding themselves less and less financially secure. And this becomes a large threat. And I truly believe this is the right time to pass legislation to protect consumers. And I'm sure Laura will talk more about what it was like to pass legislation to protect consumers during the pandemic.
Thank you so much, Natasha.